Middle of a work
That
shift,
is not half of it.
66-year-old Joyce Gorham-Worsley decided to step out to lunch with a friend.
Call girlfriend, let's go to lunch.
Like many, she just needed a quick break, but this lunch break was different.
Get to lunch and tell her, I don't feel good. And she says, you don't look good. And so I put my fork down and she said, I'm going to call EMS. I could not get up from the table.
Doctors later confirmed Worsley was having a stroke. She was rushed to the hospital where timing made all the difference.
They gave me a shot, some medicine that if you give a stroke victim within 2 or 3 hours, it put a really difference on your outcome.
Joyce was later transferred to Moses Cone Hospital for continued care. Nurse practitioner Liz Delatorre says strokes most often affect people over 50, but they also see patients in their early 20s.
Especially if they have certain genetic risk factors such as a hypercoagulability.
She says symptoms can include balance issues, dizziness, sudden loss of vision, and facial drooping.
When you have a stroke, when you have an ischemic stroke and a blood clot is blocking off blood supply to part of the brain, you're losing thousands of brain cells every second. So if someone thinks they're having a stroke, they should call 911 and get to the hospital immediately.
Now focused on prevention, Worsley works with Cone Health's Community Stroke Awareness Prevention Group, sharing her experience to help others recognize the warning signs.
I don't want people to go through what I went through.
We just heard one person's story of how having a stroke impacted her life and the importance of being proactive to help reduce your risk. Dr. Donald Heck with Cone Health Neurosurgery at Greensboro is here to talk all about strokes and what you need to know. First off, Dr. Heck, thank you so much for joining us.
Oh, you're welcome. It's really good to be here.
Yeah, an important conversation too. To start here, who's at risk for strokes?
Well, wouldn't it be nice if it was only old people and sick people, right? I mean, we know that strokes are more common as we get older, but the truth is that I'm at risk for having a stroke and so are you. Strokes affect people of all ages, young people, old people, people in the middle, people who are very healthy and people who aren't. And actually, sometimes it's hard for doctors to make a diagnosis of a stroke in a young patient because it's not what we think about. But the truth is that we're all at risk for having a stroke.
And what are the symptoms and signs?
So the most common symptoms would be drooping of the face or sudden weakness of one arm or the other, or sudden difficulty speaking or understanding what other people are saying. Other symptoms would be a sudden difficulty with balance or a sudden inability to see, to say one side of your body or to see out of one eye. There is an acronym for this. It's called B-FAST. It stands for, B stands for balance, E stands for eyes or a visual loss. The F stands for facial weakness. The A stands for the arm. The S stands for speech or language problems. And the T, which is maybe the most important one, stands for time to call 911, because there are effective treatments for stroke, both medical treatments where we administer medicines and certain types of surgeries. But all of those treatments are very dependent on getting them done early. So it's important that people know to call 911 and to seek immediate attention.
And could patients could they experience those symptoms, at the same time, like one or two, or does it just, one symptom happen? How does that work?
Yeah, that's a great question. Yeah, so oftentimes more than one symptom is present at the same time. So the larger the stroke, the more symptoms are going to be present. So, for example, a major stroke in the left side of the brain might present with an inability to talk and also an inability to move the right side of the body. So when more than one symptom are present, that increases the likelihood that we are dealing with a stroke, and also usually indicates that the stroke may be larger, in which case the immediate treatment is even more important.
Sure. Are there health issues people should be aware of that may increase their risk of having a stroke?
Yeah, there sure are. So the good news is that they're the same health issues that increase your risk for having a heart attack. So we know that smoking is a major risk. So we need to stop smoking if we smoke. And then other medical conditions like high blood pressure, diabetes, high cholesterol, these need to be treated in order to lower our risk of having a stroke or a heart attack. And then the other would be family history or genetics, but we can't do a lot about the genes that we inherited from our parents, but we can do things about our blood pressure and our cholesterol and our diabetes if we have it, to make sure that those things are really well taken care of. And that lowers our risk of having a stroke, but also lowers our risk of having a heart attack.
Sure. And what does someone with a family history of stroke need to be aware of?
Yeah, and as we talked about, you can't do a whole lot about what your parents gave you in terms of your genes, but if you have a strong family history of strokes and heart attacks, it's even more important to be on top of your health and being on top of your blood pressure and on top of your cholesterol, your diabetes if you have it, to not smoke, and to get a moderate amount of exercise and to eat a healthy diet. You know, all of these things are important, not just for lowering your risk of having a stroke, but also for lowering your risk of having heart attack, cancer, and truthfully, if you take good care of yourself, you're going to feel better. So it's they need to do those things even more so than everyone else if you have a strong family history of stroke or heart attack.
So let's start here. Talk more about steps we all need to be taking to help lower our risk for stroke.
Yeah, I would say that the first step is to really have a conversation with your primary care healthcare provider. This is really in their wheelhouse in terms of how to lower your risk of having a stroke or a heart attack. And if you go in there and say, you know, I really want to lower my risk of having a stroke or a heart attack, I want to have a normal blood pressure, I want to have a normal cholesterol, they're gonna love that. Every doctor loves a motivated patient, and so I think it starts with a conversation with your primary care healthcare provider about lowering your risk factors for stroke and heart attack, and that's a great place to start.
Absolutely. And we spoke about signs and symptoms of a stroke like facial drooping and others. If we notice any of these signs, what do we do?
Yeah, so the key thing to remember is that it's an emergency. So when you're having a stroke, what's actually happening is a part of your brain isn't receiving enough blood flow, it's not receiving enough oxygen to function normally, and if that goes on for long enough, that part of the brain is permanently damaged and won't recover. So when we notice these signs of having a stroke, we have to realize it's an emergency situation, that there are effective treatments, but they have to be administered quickly. So it's a 911 call. It's not time to wait around and see if it gets better. It's not time to take a nap and see if you feel better when you wake up. It's an emergency, and that's really what we need to remember, that it's a 911 call when we are having stroke symptoms ourselves or when we witness somebody that's having stroke symptoms.
And I have to ask, Doc, what are the dangers of waiting?
Yeah, so the effective treatments we have are only effective if they're administered quickly. So if we wait too long and the brain is without blood flow and oxygen for too long, the damage can be permanent, and then there may not be things that we can do to help. So the danger in waiting is that we may miss the opportunity to save brain tissue and in that way limit the disability that a person might experience after having a stroke. So we don't want to wait around because we want to save as much brain as we can, and that's where the time is brain saying comes from, is that the sooner we get to things, the more benefit they're going to be to the treatments we have to offer.
That's definitely a key point. Let me ask you this. What's a common misconception about strokes that you want to set straight?
Yeah, so probably the most common misconception is that it won't happen to me because I'm too young, I'm too healthy. The fact is that, you know, as we talked about earlier, they're definitely more common as people get older, but when a person is having those symptoms, even if they're young, healthy, it could be a stroke. I mean, there are a lot of things that affect young people, and just as physicians sometimes have trouble making that diagnosis, sometimes the public also may not think about stroke because somebody is otherwise young and healthy. So when we see those symptoms, it's an emergency. We want to get to the emergency room where physicians are there at a stroke center to sort out what's really happening with the patient, and if it is in fact a stroke, to administer emergency treatments in a timely fashion.
All right. Well, thank you so much for having this important conversation. Again, if you may have missed this entire conversation, you can find it on our website, WFMYnews2.com.